In this video by Deckplate, we will understand the VA disability ratings for mental disorders, schizophrenia, delusional disorder, other specified and unspecified schizophrenia spectrum, and other psychotic disorders. Schizoaffective disorder, delirium, major or mild neurocognitive disorder due to HIV or other infections, major or mild neurocognitive disorder due to traumatic brain injury, major or mild vascular neurocognitive disorder, unspecified neurocognitive disorder, major or mild neurocognitive disorder due to Alzheimer's disease. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA recognizes several mental disorders, each associated with specific diagnostic codes. These conditions can significantly affect a veteran's ability to work, maintain relationships, and manage day-to-day activities. Schizophrenia. Diagnostic code 9201. Schizophrenia is a chronic mental health condition characterized by distorted thinking, delusions, hallucinations, and impaired social behavior. Delusional disorder. Diagnostic code 9208. Delusional disorder is a mental illness where a person has one or more delusions without any accompanying prominent hallucinations or disorganized behavior. Other specified and unspecified schizophrenia spectrum, and other psychotic disorders. Diagnostic code 9210. This includes psychotic disorders that don't meet the full criteria for schizophrenia, but still involve delusions, hallucinations, and disorganized thinking. Schizoaffective disorder, diagnostic code 9211. Schizoaffective disorder is a combination of schizophrenia symptoms and mood disorder symptoms, such as depression or mania. Delirium. Diagnostic code 9300. Delirium involves sudden confusion, often due to illness, surgery, or medications, and results in difficulty thinking clearly, paying attention, and memory problems. Major or mild neurocognitive disorder due to HIV or other infections. Diagnostic code 9301. Cognitive decline caused by HIV or other infections, leading to issues with memory, decision-making, and motor function. Major or mild neurocognitive disorder due to traumatic brain injury. Diagnostic code 9304. Cognitive disorders caused by a traumatic brain injury, affecting memory, executive function, and personality. Major or mild vascular neurocognitive disorder. Diagnostic code 9305. Cognitive decline due to problems with blood flow to the brain, such as after a stroke or related to vascular diseases. Unspecified neurocognitive disorder, diagnostic code 9310. This includes neurocognitive disorders that don't meet the specific criteria for other conditions, but still involve noticeable cognitive impairment. Major or mild neurocognitive disorder due to Alzheimer's disease, diagnostic code 9312. Alzheimer's disease is a progressive condition that affects memory, thinking, and behavior, eventually impairing daily functioning. The VA uses the same general rating formula for mental disorders for all the conditions listed. 100% rating. Total occupational and social impairment, due to such symptoms as gross impairment in thought processes or communication, persistent delusions or hallucinations, grossly inappropriate behavior. Persistent danger of hurting self or others, intermittent inability to perform activities of daily living, including maintenance of minimal personal hygiene, disorientation to time or place, memory loss for names of close relatives, own occupation, or own name. 70% rating. Occupational and social impairment, with deficiencies in most areas, such as work, school, family relations, judgment, thinking, or mood. Due to such symptoms as suicidal ideation, obsessional rituals which interfere with routine activities, speech intermittently illogical, obscure, or irrelevant, near continuous panic or depression affecting the ability to function independently, appropriately, and effectively, impaired impulse control, such as unprovoked irritability with periods of violence. Spatial disorientation, neglect of personal appearance and hygiene, difficulty in adapting to stressful circumstances including work or a work-like setting, inability to establish and maintain effective relationships. 50% rating. Occupational and social impairment with reduced reliability and productivity due to such symptoms as flattened affect, circumstantial, circumlocutory, or stereotyped speech, panic attacks more than once a week, difficulty in understanding complex commands, impairment of short and long-term memory, impaired judgment, impaired abstract thinking, disturbances of motivation and mood, difficulty in establishing and maintaining effective work and social relationships. 30% rating. Occupational and social impairment with occasional decrease in work efficiency and intermittent periods of inability to perform occupational tasks, although generally functioning satisfactorily with routine behavior. Self-care and conversation normal, due to such symptoms as depressed mood, anxiety, suspiciousness, panic attacks weekly or less often, chronic sleep impairment, mild memory loss such as forgetting names, directions. Recent events. 10% rating. Occupational and social impairment due to mild or transient symptoms, which decrease work efficiency and ability to perform occupational tasks only during periods of significant stress. Or symptoms controlled by continuous medication. 0% rating. A mental condition is formally diagnosed, but symptoms are not severe enough either to interfere with occupational and social functioning or to require continuous medication. Thank you for watching this video. Please don't forget to subscribe and like our videos.